Hello and welcome to our channel. Today we're diving into a story that sounds like it's straight out of science fiction, but it's very real and it offers a beacon of hope to millions. We're talking about a world-first medical achievement that could change everything we know about treating a chronic disease. For the first time in history, scientists have successfully reversed type 1 diabetes in a patient using a revolutionary stem cell transplant. This isn't just a step forward, it's a giant leap in regenerative medicine. A 25-year-old woman in China, after struggling with the disease for over a decade, is now living a life free from insulin injections. This groundbreaking procedure used the patient's very own cells, marking a pivotal moment in the fight against chronic illness. Stick with us as we unpack how this remarkable feat was accomplished. So what makes this announcement so significant? First, it's a world-first achievement. Scientists have successfully used a stem cell transplant to reverse type 1 diabetes. This procedure, published in the prestigious scientific journal Cell, is a major medical milestone that is being celebrated by researchers globally. The patient is a 25-year-old woman from Tianjin, China, who had been dependent on daily insulin shots for over 10 years to manage her condition. The revolutionary procedure was minimally invasive, and most importantly, it used her own reprogrammed cells to restore her body's natural ability to produce insulin. As transplant surgeon James Shapiro from the University of Alberta stated, "They've completely reversed diabetes in the patient, who was requiring substantial amounts of insulin beforehand." This expert validation highlights the profound success of the treatment. Let's take a moment to understand the human impact of this breakthrough. Imagine a life dictated by needles and constant vigilance. For over a decade, this 25-year-old woman's life was a cycle of insulin injections, constant blood sugar monitoring, and a carefully managed diet. But after the procedure, in June 2023, everything changed. Her body began to produce its own insulin again, and the results have been sustained for over a year. She has regained her natural insulin production and discovered a newfound freedom in her food choices. In her own words, she says, "I can eat sugar now. I enjoy eating everything, especially hot pot." This simple, joyful statement captures the life-changing nature of this outcome, a freedom that millions of others with type 1 diabetes dream of. How did the science actually work? The process was as innovative as it was effective, broken down into 3 key stages. First, cell conversion. Scientists took cells from the patient's own body and chemically reprogrammed them, turning them back into a pluripotent or master stem cell state. Second, islet growth. These stem cells were then guided to grow into brand new clusters of islet cells, the very cells in the pancreas that are responsible for producing insulin and regulating blood sugar. Finally, transplant surgery. In a minimally invasive procedure that took only about 30 minutes, these new islet cells were transplanted into the patient's abdominal muscles. The timeline was remarkable. The procedure was done in June 2023. Within just 2.5 months, a patient was producing enough of her own insulin to stop injections. And now, over a year later, she remains insulin independent. The use of her own cells made it a truly personalized and successful treatment. Let's dig a little deeper into the science. At the heart of this are stem cells, which are special cells with the amazing potential to develop into many different cell types, offering incredible regenerative possibilities. The beauty of this procedure is its personalized approach. By using the patient's own cells, the risk of immune rejection is virtually eliminated. This often removes the need for powerful immunosuppressant drugs that traditional transplant patients must take. The treatment mechanism is elegant. The reprogrammed cells regenerate the body's lost insulin-producing function. The abdominal muscles were chosen as the transplant site, providing an optimal environment for the new cells to thrive. However, there is an important consideration. This patient was already taking immunosuppressants for a previous kidney transplant. Researchers will need to conduct more trials to see if the treatment is just as effective for patients who are not on these medications. The results of this treatment have been nothing short of spectacular. The rapid recovery saw the patient begin to produce her own insulin in just 2.5 months. She now has stable blood sugar without the dangerous spikes and drops that characterize type 1 diabetes. This has led to complete insulin independence. She no longer needs any injections or monitoring. As a result, her normal diet was restored, dramatically improving her quality of life by allowing her to eat normally again, including sugar. Amazingly, her blood sugar levels are now within the target range over 98% of the time, and these incredible results have been sustained for more than a year. As one researcher noted, "That's remarkable. If this is applicable to other patients, it's going to be wonderful." To understand the importance of this breakthrough, we have to look at the bigger picture. The global diabetes crisis affects nearly 500 million people, with millions of deaths attributed to it annually. Type 1 diabetes is an autoimmune condition where the body destroys its own insulin-producing cells. So how does this new procedure stack up against traditional versus stem cell treatment? Traditional treatments often rely on islet transplants from donors, which are extremely limited in supply and require lifelong immunosuppressant drugs to prevent rejection. This stem cell therapy, however, offers huge advantages. By using a patient's own cells, there is a potentially unlimited supply and no rejection risk. This could transform the treatment landscape for type 1 diabetes worldwide, making a cure accessible to far more people than ever before. So what comes next? This breakthrough is a monumental first step, but the journey isn't over. Researchers now need to conduct larger clinical trials to confirm these results across diverse populations. They will need to define clear criteria for patient selection and navigate complex regulatory approvals to make the treatment globally available. Key questions remain about the role of immunosuppressants and, crucially, strategies must be developed to make this treatment affordable and accessible worldwide. But the potential is immense. This could not only transform the lives of millions with type 1 diabetes, freeing them from daily injections, but it may also open doors to treating other autoimmune conditions. The future of medicine is unfolding before our eyes, offering a new definition of what's possible and a powerful new reason for hope.